We see such a wide spectrum of mental health when we're going out both to operational incidents and carrying out our prevention activities. And I think organisationally there's some work that we can do to support our frontline staff when we meet some of those challenging mental health conditions.
When we started working together, when we looked at the role emerging placement for third-year students, we put 2 students in together working with the fire service for part of the time, and the other part of the time the occupational therapy students were based with occupational therapists working in mental health services for older people. So they had the backup of the occupational therapists, but were able to work in Nottinghamshire Fire and Rescue Service.
Crossing ground has been met. So rather than working as the OTs and working as the persons at risk team, what we've seen is a linkage between those 2 services. So we've done reciprocal training, there's been the establishment of the Role Emerging OT student, and doing events together as well as the casework together, which has allowed us to keep the individual safe at home, doing cooking in a way that they used to do it, but in a safer way with the equipment that's been advised by the fire service.
For a number of years now, Nottinghamshire Fire and Rescue Service have been carrying out home safety checks, and we've always been quite risk averse in how we do these home safety checks. So as an example, if we saw somebody who had memory issues and was cooking with gas and maybe having some issues with that, is we would have potentially put forward that the gas be capped off and then move to a different type of cooking, or even getting meals brought in. That's how we used to do it. Obviously, working with the occupational therapy students now, it's sort of turned it on its head quite a bit, especially in the persons at risk team. We now look at a more holistic approach, and actually we look at the person and see what they want to do. And then we try and manage that risk better, rather than saying being risk averse and causing issues for that person.
With the use of historical fire data, the fire service created a profile for the type of person that is more likely to be involved in a fire. Risk increases where a person presents with multiple circumstances from the profile, i.e. cooking or smoking by themselves can be risky, but if the person cooks or smokes whilst under the influence of alcohol or drugs, and lives in a property that is hoarded, the risk of fire is greatly increased. An acronym was created, Charlie, who could be male or female, to assist in highlighting the at-risk circumstances.
I've been a clinician in MESOP for about 13 years, and over that time services have changed a lot, and we're, I think, far more open about partnership working and what values it offers, really. As a clinician, I think I've learned an awful lot from working with the fire service. I think it's given me a wider perspective, really. I think it's, when you're doing an assessment, you look at what somebody can do and you look at how they're managing and how they're functioning. But to have the wider scope of what that means within the community and what that means for other services and how you can all link in and actually work together, I think I've learned a lot about that. By doing the joint visits, that's happened over the last sort of 4 or 5 years. I think we've increasingly done that because we've realised that we are seeing the same population. We can have a better outcome if we work together for those people, and we can look at ways of improving their lives rather than limiting activities, which I think perhaps when people are more risk averse, things get limited and someone's opportunities are reduced in terms of how they can live. But I think we can work in a far more person-centred way by working together.
I took in a kitchen assessment to show the firefighter what it is that I'm actually looking for in such what seemed a simple observation, so we could see how they were functioning cognitively, their physical mobility. Things such as, can you show me going up and down the stairs, to look at the safety in that movement of up and down the stairs and getting on and off the toilet, because if someone was to fall over getting off the toilet, us being in there, having observed them doing it, we can keep that person safe instantly. That's something a firefighter could do so easily on their home safety check. You can see the difference in the firefighters that have worked with an OT on a previous placement. However, some that haven't would deem it as, that's going to put you in danger, we need to remove that and get that away. So OTs definitely view risk slightly differently.
The students have brought a totally different way of the part working with individuals. As I say, we used to be quite risk averse. It's now flipped totally, so that we look at the individual and then we're looking at how they interact in their environment. There's been skills given both ways. You know, the OTs have learned what we do as a fire service, and how the risks that we look for can impact onto their role, and likewise.
So what I'd say is, before, when the referral was made and the fire service would have gone in, probably what would have happened is a smoke detector would have been put up in the lounge or in a place where the individual was a lot of the time. And potentially, if that person was mentally unwell, they might get quite paranoid about the flashing light, and agitation be increased by that. So by the OTs working with the persons at risk team, the placement of the smoke detector would have been more appropriate. And also, what probably would have happened in the past, if the individual was a big chip pan user, that would have just been taken away, and we've been looking at microwave cooking, whereas I think through the joint working we're looking at creative ways of enabling individuals to be safe.
I can now go into work having learnt so many different safety tips from the firefighters that I'm not only going to take into work, I've taken home. It has taught me so much.
In seconding an OT student in, we're also looking at bringing in an environmental health officer. So when we cross the threshold into people's homes, there are three areas we can look at: fire safety, the health and well-being of an individual, and also their environment. And what that does, hopefully, in developing this process in the future, is make sure that the fire and rescue service, along with the occupational therapist and the environmental health officer, really are making every contact count.
Obviously, we've been doing this work for a number of years, and we know the benefit of working in partnership with our colleagues who serve our same population. But with the current pressures, financial, economic and demographic pressures that all our services are under, the sustainability and transformation plans are out there now in terms of Nottinghamshire, and they're pushing the agenda of prevention and integrated and collaborative working. So whilst we've been doing it already, we clearly need to maintain this and continue this.
The fire service are looking at widening their agenda. They're looking at health and well-being and things like making every contact count. And I think the occupational therapist will be the sort of key person to help the fire service do that, to look beyond Charlie, but also about promoting health and well-being.